Hi guys, welcome to my second video on this channel, and please come back and be sure to check out our videos every Monday and Friday for more things psychology and wellness related. So today's video we're going to be focusing on how to find the right psychologist or therapist for you. Now, it's important to find the right psychologist for you because if you don't find someone that you feel is competent for the problem that you're bringing and something that you want to work on, as well as if you feel there's not a right fit for it, you won't be able to progress into what we call a corrective experience, where we can elicit change, challenge belief systems, thought processes, as well as accessing the unconscious. So no two therapists are alike. We bring our personalities, not fully because we don't want to eclipse the client with their stories and what they bring, but it is important to connect with a psychologist that you feel is human with you and that you feel understood with and that you don't feel judges you. Okay, so your first step to determining who will be the psychologist that is going to help you is to find out what is the problem that has led you to seek out psychotherapy. Has someone told you that you need therapy? Has a medical doctor told you? Has a family or friend? Do you have relationship problems? So it's important to start to really unpack what it is that is making you want to seek therapy. Now, sometimes people don't exactly know what is the problem. They rather just focus on aspects of, I don't feel alive, I don't feel happy, I feel like it's difficult to function in my day-to-day practice, or my day-to-day life, or my day-to-day, functioning in my family. But it is important to at least start to see what it is. So is it anxiety? Do you have a substance abuse problem or a process addiction problem? Do you find that you're worrying about getting to retirement and the end of life? Are you grieving? So it's all those types of things that are going to help you to funnel down your search to find the right therapist for you. Another thing that's important to mention is that normally what we call the presenting problem, the problem that brings you to therapy, is actually a symptom of a broader problem. So a good example of this would be, for example, if, say, you are using alcohol for loneliness, or you're using a substance or another person in a relationship to alleviate some type of guilt that you have, or codependency issues, or perhaps you are reenacting an old trauma in the past. Is all of those things are going to lead you to start to question what it is that's making you feel stuck in your life, or where you feel you can't progress. Okay, so as soon as you start to get a sense, remember, you're not going to know everything before you start, but just a general. So if it's anxiety, depression, whatever it is that's taking you, that will help you to narrow down your search. Okay, so as you become clear about what you feel you need to work on, you need to now move on to the investigative part, where you start to ask around. So you can ask someone that you trust. So someone like your medical health professional, a nurse, any allied therapeutic service, for their recommendations, as they work with psychologists, and usually they work on word of mouth from their own patients on what is working for them. If they hear that someone is ethical, or if someone is really competent in a specific field. So that's your first point of departure. You can ask your medical or any allied therapeutic service, physiotherapy, biokinetics, anything like that will be able to start to help you. If they can't give you a referral for your presenting problem, so say you're looking for somebody that is well geared towards couples therapy, then you can start to go online. Now, with this filter of, this is the problem that I have and this is what I'm looking for, you can start to look for therapists in your area or beyond. Some people prefer online, some people face-to-face, some people want in the area, and some people outside of the area. But from there, you can start to see, okay, let's check out this psychologist profile and what are their core areas or specialties, or core areas and specialties. From there, if you say, for example, are dealing with some type of anxiety problem, general anxiety, post-traumatic stress, or if there's something in terms of like obsessive compulsive tendencies, anything like that, grief, then you can start to look for therapists that are in those types of fields. Now, the next aspect that I get a lot of questions of, especially in the Instagram private messaging, is sometimes people feel more comfortable based on their story or what they bring to see either a male or a female, or maybe perhaps someone older or younger, because of a trauma aspect that they have in their past, or maybe they had a bad experience with females, or they just want to have a close relationship with somebody of the opposite sex, same sex, etc. If you are of the LGBTQ community, it is important that you check that you are talking to a therapist that is LGBTQ friendly. We all should be LGBTQ friendly. So finding a right therapist is so important as well, because it's so collaborative, and you're going to be working with your therapist. Yes, they will be doing the work to reflect to you what they're seeing the patterns in your behavior and your thinking mechanisms. But you, at the end of the day, have to feel comfortable to be able to speak to them, and that they can go to where you need to go. So it's important then to see what type of therapy you want to go into. So after you've had a look at the profile of the therapist, looked at their picture, some people really want to see a picture to get a sense of your face, even though a picture doesn't really say much, but it's a good introduction, is then you can start to see what type of therapy you want to do. Now, there are different types of therapies, but most psychologists are very integrative. You do get purists, like purely psychodynamic or purely CBT, but you can check that out in the therapist profile. So if you're wanting something that's more short-term therapy, that it's very guided, you do a lot of exercises, those are things like for panic disorder and things like that, a CBT therapist would be good for you. But if you're looking for something that helps you really access the unconscious, go into childhood, go into your relationships, and give you more depth and understanding into why you do the things you do, then a psychodynamic or depth therapist is something you probably would look for. Now, some of them could be something like integrating psychodynamic with existential or things like that, but it's important that you get a sense that when you go and speak to your therapist, you're not just going to speak about the here and now, the problem now, but to trace it back to see what is the real source of the problem, if that is what you want to do. If you're dealing with things like trauma and you want some type of somatic therapy to complement the unconscious or depth therapy, or any type of trauma-related psychotherapy in any way, you'll have to look for that under the therapist profile. So there you have a really good start to starting to funnel down and see who's available and what is it that you need, especially for your presenting problem. After you have decided you want to start making contact with the couple of therapists that you like, and you can start to inquire into their availability to fit into yours, as well as to look at also the pricing. So are they below or above the medical aid rate? Because you'll need to plan. Now, why is this important is when you see a psychologist, it's not like seeing a medical doctor where you go in once or twice for most therapies, and they just tell you what to do and they give you medication. It doesn't work like that. You actually need some time with a therapist to not only get to know your history and the pattern of behavior as to why you're suffering with whatever ailment or whatever it is that you worry about, or things that are happening in your relationships, is because the therapist has to get a good sense of you with your history to build a collaborative plan or intervention plan with you. And that can take quite a bit of time. It's depending on the severity of the problem and any underlying elements. So it's important to really plan financially, and if you're using a medical aid, to see what the medical aid is willing to provide, so you can tell your therapist upfront and it can be planned around that. Usually it takes a therapist about 1 to 3 sessions to start to get a sense of what is the problem, where it comes from, and a brief overview, a brief history into the pattern of behavior that has led you to this point in your life, and to help you to start to examine your role in the problem and how you can, for example, have more voice in your life, to have more empowerment, to set more boundaries, to see why you have guilt or shame or or loneliness, any of those things that are going to happen. But it's important to remember that you're dealing with your mind. You're not dealing with a body part, although it is connected, of course, that can just be healed in a matter of weeks with medicine. Is that collaboratively you have to be willing and ready to delve into the mind with your therapist that you trust. And so all of those things are going to be a very good starting point to get you geared up and ready. So insight-orientated therapy looks at understanding your worldview within your life and also unpacking how you feel as a participant in your own life. So do you feel things happen to you and people are purposefully out to hurt you or get you? Do you dream sometimes of people chasing you, disrespecting you, punishing you? Or do you believe that you actually have a role to play in either repeating these patterns of behaviors where you feel you aren't worthy of speaking up and putting up boundaries and saying no in all the different forms? These types of things are going to be explored in therapy, as to not only empathically healing all of those things in your life, but also understanding, how did it get to this point? How did we get to the juncture where you feel so disempowered from your everyday life and your external world? So therapy will help to unpack these unconscious behavioral patterns if you see a psychoanalytic or psychodynamic therapist, to give you more empowerment to choose a role you feel is more authentic to who you are inside. That is why choosing a therapist is so crucial, because with time you will be opening up to them and trusting them with your most innermost thoughts and feelings and fears, and you cannot do that if you don't feel comfortable or safe. So the next step is actually to book the first appointment and to go and meet your therapist. Now, a lot of people think that the therapist is just meeting you and getting to know you, but you in fact are also getting to know your therapist to see if you feel comfortable in not only the way they approach therapy and their training, as well as their psychotherapy practice, as in their worldview of how they see things, but also you also have to see how their energy, the way they are, the humanistic side of them is. Some, especially depth therapists, might be a little bit more quiet to give you more space to speak. And if you ever feel that you're not engaging enough, so if you don't feel that your therapist is talking enough or answering enough, you can tell them that for you it feels like sometimes you would like a little bit more engagement so that they can see what you need. The reason why they do that is to give you so much space to project onto them all of the unconscious conflicts you have, all of the aspects within you that you need to start to understand about yourself and how you see the world around you. You are, as a client, entitled to ask questions about the therapy, about the psychologist, their training, and if they are governed and registered with the Health Professions Council of South Africa. And it is important that you ask these questions, because then you feel that you're right next to the therapist. Because remember, your therapist is not like a doctor that's above you. They collaborate with you. So a good fit in psychotherapy is of the utmost importance, because without the corrective experience, you won't be able to go as deep as you need to go to understand the source of the problem. And you won't be comfortable to be able to show all the things that may bring you shame or guilt, or things that you feel you may be judged on. So it is important that you're very honest with your therapist, and with time you can tell them almost anything. You're also looking for a human being that you feel a connection to, besides all these qualifications and specifications. And it's important that you feel that you feel while you are seeing a therapist that the person on the other side is not just taking notes or just listening to you, but they actually are engaging with you. So don't be afraid to ask questions. Don't be afraid to get to know if the therapist is doing that. So you test your assumption, because remember, we are relating to others the way we know now. So if, for example, I have a core belief about myself that people don't listen to me, and I see a therapist that doesn't speak much, that then confirms my core belief. When in fact, if I bring it up to my therapist and I say, okay, I feel like I speak a lot, and then I'm waiting for an answer, I'm waiting for a little bit of engagement, and I feel sometimes maybe I'm asking too much, or I feel maybe on some level you may not be listening to me as much. It does get like that, and sometimes the therapist needs to hear that your need is you need a little bit more engagement, because for you at the moment it feels very personal. And it's part of the therapy is that with time, you always need to be encouraged to speak your mind and to say what you need within reason. Of course, we can't bend our boundaries to, see you at any moment of any day and to do certain things. But in terms of your emotional needs within the therapy space, it is important that you feel heard and that you have your needs be heard. So anyway, I hope that this was helpful in starting to understand and think about why you need to or want to explore a therapeutic process. It can be exceptionally life-changing, especially with the right fit. Please don't be afraid to shop around until you find the therapist for you and the one that you feel comfortable with. But give it a session or two to get a sense, and also to give them a chance to get to know you and to see if they are able to help you with the presenting problem that you're giving them. I always advocate to give psychologists, if I'm referring a family member of a current client, 1 to 3 sessions to get a sense of them and to see if they can help you based on all the history that is coming up. But you also have to trust your gut and see how you feel comfortable. I hope this was helpful, and I wish you all the best in starting to search for your therapist.